Breast cancer is the most common cancer among Canadian women, and early detection of the disease can make it easier to treat. That's why doctors say it's important for women to know how their breasts will change throughout the years and also to recognize potential risk factors. So joining me now is Dr. Melinda Wu, a family doctor at Women's College Hospital. She works with the Peter Gilligan Centre for Women's Cancers, a partnership with the Canadian Cancer Society. Thank you for being here this morning.
Thank you for having me.
Let's start with birth control. What do women need to know about taking the pill and how it can affect their risks?
Absolutely. I should start by saying probably that risk is so individual. And when I think about somebody's risk and how to counsel them about the birth control pill, I think about your age, your health history, your family's health history, lifestyle factors. And the birth control pill has come up many times over the years and has been kind of controversial. I think where we've landed presently is that while you're on it, and for a few years after, you might be at a little bit of an increased risk, but there isn't a long-term risk to you.
Okay, that's good to know, because you're right. It kind of has changed a lot over the years. What about having a child or not having a child? Can that affect your risk?
Absolutely. Having babies, we can't control when we have babies, but we know that when you have your first child well below the age of 30, 35, it can decrease your risk of breast cancer. There's something protective about being pregnant and breastfeeding your baby. Some of it is that when you're pregnant and breastfeeding, we often don't get periods. And so if you do this multiple times over your lifetime, it decreases your overall exposure to hormones in your life. And so women who have had children, no matter what age, are probably at less risk than women who have not had children. But we know that if you have your child well before the age of 30, that's very protective for you. It decreases your risk overall. Pregnancy itself also, I consider, a high hormone state. We know that from the tears and the emotions and all of that come with it. And so for a small number of women, we do see breast cancer diagnosed while they're pregnant. I don't think it causes breast cancer. I don't think it's a particular risk factor for breast cancer, but we do see it as an environment sometimes that fosters breast cancer to grow in a small number of cases. I think the bottom line is pregnancy and having your first child below the age of 30 decreases your risk.
Okay. What about a little later in life, women who are going through menopause? How can taking hormone replacement therapy play a role?
Yeah, so why do we take hormone replacement therapy? When we go through menopause, the hormone levels in our bodies fall. And so with that comes hot flashes, night sweats, mood changes, difficulty sleeping. And sometimes we replace those hormones with HRT, or hormone replacement therapy, to help with those symptoms and reverse them. Through menopause, the breast tissue also is expected to change. It goes from less or more dense when you're premenopausal to less dense or more fatty afterwards. So when you add back hormones to the breast tissue at that time, it tends to revert back a little bit. It becomes a little bit more sensitive, more lumpy bumpy, more dense. It makes mammograms harder to read. And so it does affect your breast cancer risk in a small way.
You mentioned how things change over the years. Just very quickly here, what are some things we should look for at different ages?
I think your biggest risk factor probably is age. We see the most breast cancer after the age of 50, but I certainly see it before the age of 50. I tell women to get to know the lay of the land. Everyone's going to have a different landscape in their breast tissue, and just get to know how it feels, how it changes over the month. And if something comes and goes, great. If it stays around, then see your doctor. Things that I look for are skin changes like redness, nipple changes, dimpling to the skin, and of course, if you feel a lump. Overall, if you know your health and you kind of know your body, if you feel like you have a question, that's a good time to see your doctor.
Dr. Melinda Wu, thank you so much for being here today.
Thank you so much.